This is Dr. Narendrakumar from Chennai. We'll be demonstrating a very interesting case of a nasal mass which is very huge, can't be delivered by the nose, so we delivered by the oral cavity. My sincere thanks to Dr. Vivek and so much thanks to Dr. R. Mahendran, surgical oncologist, for referring this case. A 28-year-old boy present to us with a nasal mass like this, and he was having the difficulty of swallowing and breathing for the past decade. So he was a little unaware of the disease, and the screening of the scans showed that very huge, large, lobulated lesion which was obscuring the nasal cavity, more likely JNA, and differential diagnosis was schwannoma. The age is 28, and the patient never had a episode of bleeding before. This is a nasal cavity, right side nasal cavity. You will see the mass. More likely it is a JNA, and you can see a oral cavity. I'm pressing the tongue, which is pushing the soft palate like this, and uvula. Very huge mass, which is descended completely down to the oral cavity. We did a tracheostomy for intubation as we can't able to do it. So tracheostomy was done and septoplasty was done. So we get a good space on it. You can see the mass attached to the nasal septum. This is the right nasal cavity attached to the nasal septum here, and the mass is not much extended to the pterygopalatine fossa, just in the sphenopalatine foramen attachment. It is not a unique presentation of JNA. There was it is actually a unique presentation of JNA. There is a small difference of presentation in it. The usual spread is not there, as we started the case with middle meatal antrostomy. We opened up the maxillary sinus. We partially excised the middle turbinate. We made an utmost care not to touch the mass. We are going out around the mass and detaching it from its attachment. The initial attachments, we could observe it from a nasal septum. So using a coblation, we are just separating it. And the nasal mass was very huge, and we are sure from the scans it was not deep inside the foramen infratemporal fossa. So the predominant nasal mass was there in nasal cavity alone. So we are just working on the sphenopalatine foramen area, detecting the mass. Coblation is a very important tool and very essential for the vascular lesions dealing with it. So you can see we are working in a avascular plane. And that's how our dissection goes on. We are widening up the middle meatal antrostomy, and plan is to cauterize the feeding vessels, the sphenopalatine artery. As the mass is not posterior to the maxillary sinus, we are not much to open up, and we are not much worried about the vessels over there. So we are partially removing the inferior turbinate for the good access. We are keeping the posterior part of the inferior turbinate little. The video was a little fast forwarded for the time lapse. Our main aim is to remove the mass to the maximum and give the good symptomatic relief to the patient, and we are very sure that we should not give any big complication to the patient, as the patient is very young, and that's the aim of the each surgeon, of course. By doing the posterior septectomy, we are working on a bimanual technique with two surgeons, four hands. With the gauze, we are pressing the mass posteriorly to the maximum, and we couldn't find, there was a little bleeding. You can see there was a, as the mass is very vascular, we could find a bleed coming from the nasopharynx. So using a Surgicel, we are planning to control, and usually this will control by Surgicel or bipolar, a pack of a Surgicel, where the gel foam is kept for a while. Meanwhile, we are removing the attachments, and the remaining mass where we are, it's there, all that area has been cauterized. So we are very sure that the mass is, the plan of completely removing it. This is a very unique case. As soon as the mass is excised, we send it for biopsy and came it as JNA. So you can see how we are cauterizing it, the bleeding spot. And the last final attachment of the mass posteriorly is also detached, and the mass is free. And this is a final picture of that. Of course, the mass is very huge and we can't able to deliver by the nose. So very simple, very minimal blood loss. We did this case. It's a great thanks to Dr. Mahendran for the wonderful case. The sphenoid sinus is also opened. You can see this is a final picture after the removal of the mass. While delivering the mass, we could see this mass is here, and very tough. Even with the oral cavity, we can't able to remove it. The size is very huge. It's like an abdominal mass. You can see can't be able to come out. And the small clue was pressing over the soft palate. You can see very huge one, very huge. The tumor comes out, and we removed it completely. The patient was symptomatically relief. Thank you all for watching this video. Thank you to my surgical team. Thank you all.